Hi, everybody. Welcome to our soundtrack of mental health and communications on suicide awareness. We'll get started in about 1 minute, get some more people to join us. But thank you for being here with Silence the Shame. And we'll get started in a few. Did you put one up already? We're just giving some more people get time to get in the room. We will start soon. We ask everybody to have their cameras off, so it is okay. And we'll get started. All right, so once again, everybody, welcome to our soundtrack of mental health community conversations on suicide and awareness in the workplace. And I will pass it off so that we can get started. We're going to utilize our chat room for any questions that we'll have at the end. And I'll go ahead and pass it over to Miss Natasha Daniels.
Thank you, Nivea. Good afternoon, everyone. I am honored to be here with you all this afternoon. My name is Natasha Daniels, and I am a facilitator with Silence the Shame. And welcome to the soundtrack of mental health, suicide awareness in the workplace. And before we begin, I would like to say I know this is a sensitive subject. So please, everyone, do what you have to do to take care of yourself. If you have to step away for a minute, we completely understand. Before we begin, I would like to talk a little bit about our CEO and founder of Silence the Shame, music veteran Shantae Dawes, who experienced her own mental health conditions within her own family when her father died by suicide when she was very young. Shantae also had close friends who died by suicide, which inspired her mission to empower and educate communities on mental health and wellness. And out of this mission came the vision to erase the stigma and educate communities on mental wellness through community conversations, compelling content, and outreach programs. Before we begin, I would like us all to engage in a short mindfulness activity. So I'm just going to ask everyone to close your eyes for a few seconds. I don't want you to think about anything. Don't think about what you have to do at work or what you have to do for the rest of the day. I want you to remove all distractions from your mind and just focus on your breathing. And just notice all of the senses throughout your body. Now feel free to open your eyes. Thank you all for engaging in that mindfulness activity. I just want to let you all know that whenever you feel overwhelmed, whether it's at work or even at home, that we can take those short moments throughout the day to engage in those mindfulness activities, which can bring us back to a state of peace and calmness. What are we going to talk about today? So today we're going to talk about a couple of things. We're going to do an overview of suicidal behavior. We're also going to talk about vulnerable groups that are at an increased risk for suicide. We're going to talk about the causes and risk factors of suicide, as well as stigma and warning signs. We're also going to talk about workplace suicide prevention, as well as wellness strategies that we can incorporate into the workplace that can assist in the prevention of suicide. So, what is suicide? Suicide is the direct violence at self with the intent to end life that results in death. So, any direct violence toward oneself that results in death, that's suicide. A suicide attempt is to harm to self with the intent to end life, but they do not die due to their actions. And suicidal ideation is thinking about or planning suicide. So thinking about the different type of ways that one can end their life, thinking about the different type of methods, that's suicidal ideation. It's important to note that we are in a public health crisis when it comes to suicide, and the statistics shows us this. Suicide is the 12th leading cause of death in the United States. And in 2020, there were an estimated 1.38 million suicide attempts. Suicide rates are highest among adult ages 85 years or older. And this is important to note because if we have family members that are in that older population, we want to continue to reach out and support them and check on them because we know that life doesn't necessarily end when you're 85, but that people are living well into their hundreds. So again, being that source of support and offering that encouragement to our older population is very important. Gender paradox. When we talk about the gender paradox, research has shown us that there are some key differences when it comes to men and women in terms of suicide. So, for instance, women are roughly 3 times more likely to attempt suicide, but not die by suicide, whereas men are 2 to 4 times more likely to die by suicide. And research has shown that this is because men may use more lethal weapons and have access to more lethal weapons, such as guns in the house and guns in the home. So, again, these are just some important differences to note when we're talking about the gender paradox, the differences between men and women when it comes to suicide. Suicide in those vulnerable populations, right? And we know that the LGBTQIA plus population is one of those vulnerable populations. We know that they are at an increased risk for social isolation. They face a lot of stigma. They face a lot of bullying. And so 17% of LGBTQIA plus adults had attempted suicide during their lifetime compared with 2.4% of the general US population. And this is important to note because when it comes to these vulnerable populations, we want to make sure that we provide hope and we want to make sure that we provide support. Causes of suicide. It's important to note that it's different causes when it comes to suicide. It's different factors that can come into play. And some of the causes of suicide that we want to look at is if the individual has a history of a mental health condition. Now, that doesn't necessarily mean that just because they have a mental health condition that they're going to engage in a suicide attempt. As a matter of fact, research has shown that 54% of people that engage in a suicidal attempt or have suicidal ideations are people that are not diagnosed with a mental health diagnosis, but again, are just struggling with those different life stressors. So that's important to note that when we're talking about people that may have a diagnosis of mental health conditions. Also, any type of traumatic stress. If an individual is going through an eviction or experiencing any type of financial burden, then this can increase their propensity for them to think about suicidal ideation, as well as if an individual is under the influence of any type of substance use. We know that when substance use, it increases that impulsivity to engage in those reckless and dangerous behaviors. So again, this can be an increase, one of those propensities for suicide. Loss or fear of loss. If an individual is going through a divorce, or if the individual has just broke up out of a long-term relationship, all of this can cause an increase for the risk of suicide because again, they're going through certain life stressors that are going on with them. And also, we want to be aware of if the individual is complaining of any type of bodily chronic pain, right? So, if an individual is always saying, my body is in pain, I feel pain within my body, we want to pay attention to that because that can manifest into mental anguish. A lot of the times, if we don't feel good physically, it can mess with us mentally. And again, that can increase that propensity for suicide as well as social isolation. Just noticing if an individual is staying to themselves, not being around people, not having those villages of support. All of these things are factors that we want to be aware of that can increase that propensity for suicide. And now I am going to play a short video from our CEO and founder of Silence the Shame, Shantae Dias, who talks about her own mental health challenges.
I didn't want to die. And oftentimes people don't understand that when they say, well, how could someone just kill themselves? How could they be so selfish? I just wanted the pain to stop. And I wanted to feel whole again. And I wanted to feel like myself. And so by the grace of God, my sister and my pastor and a friend of mine that I bumped into at a store just convinced me to get the help that I needed.
So that's very important to note, right? Again, a lot of people don't want to die. They just want whatever pain that they're feeling at the moment to just stop. And that's why it's important as gatekeepers and colleagues and loved ones to be able to offer hope and support and let people know that what we're going through is temporary, that bad times does not last forever. Now we want to look at those suicide risk factors, right? And again, the risk factors are characteristics or conditions that increases the person's chance that they may try to take their life. And I'm not going to read all of these, but I am going to touch on a couple of bullet points from each section because we know with the individual, we're connected to a social aspect. And by being connected to a social aspect, we're connected to the community. So, some of those risk factors that we want to pay attention to when it comes to an individual is if we want to know, does that individual have a previous history of suicidal behavior, right? It's important to note that do they have a history of trying to engage in suicidal attempts? Also feeling a lack of purpose in their life, not really knowing why am I here, feeling like life is just meaningless. It's no hope. We want to pay attention to if they're displaying those type of signs and feeling like a burden, right? So if an individual voices to us that, I just feel like a burden to my family, to my friends, we want to pay attention to things like that because again, these are the risk factors that can increase that chance for suicidal behavior. Also, when we talk about social, again, that social isolation, right? We want to notice that. We want to notice if an individual is just staying to themselves, they're not engaging with anyone. We want to pay attention to that because, again, that means that they're not getting no type of support, and that can increase that risk for suicide. We want to pay attention to, is there a family history of suicide or mental illness, right? Again, this is important because that family dynamic is important to know because again, this can be an increased risk that may increase that person's chances of trying to take their life. And then any type of generational trauma, right? We know that generational trauma can be passed down. And if people don't have, the certain coping skills or certain tools to kind of get through things, then all of this pain can kind of increase that person's risk for suicide. So things to pay attention to. And in terms of community, we know that any type of poverty, if we're living in a neighborhood that's a lot of poverty, again, a lot of financial stress, not having the means to take care of family or oneself, all of this can be a suicidal risk that can increase the person's chances of trying to take their life, as well as just the lack of social support services in that area. So if I live in a neighborhood where it's a lack of social support, I don't really know where to go for resources, and it's not really no resources in the community. That's important to pay attention to because, again, all of these are risk factors. Now we want to talk about warning indicators, right? So, as loved ones, colleagues, family members, we are the first line of defense in noticing if someone has a change in behaviors and if someone has a change in their thought process. And with warning indicators, I like to call them like red flags, things that we want to look out for that immediately send out that alarm that, hey, we may want to intervene and make sure we support and connect this person to resources. So again, I'm not going to touch on everything, but I am going to take out a couple of bullet points from each section. So when we're talking about thoughts, right, we want to pay attention to if that person is talking about suicide. So if the person is saying things like, yeah, I don't want to be here no more. My life is meaningless. I don't care if I don't wake up. We definitely want to make sure that we take immediate action by supporting that person and connecting them to resources. And we're going to talk a little bit about how we do that in the previous slides. Again, if they're talking about being a burden to others, this is important language to pay attention to because if they're saying things like, I'm just a burden to people, I'm the reason, why people are not able to enjoy their life or why people are not able to do things. We want to pay attention to that type of talk, as well as talking about killing themselves, which is an immediate red flag that we want to support that person and connect them to resources. We also want to pay attention, right, to an individual's feelings or moods. So if an individual is feeling a sense of hopelessness, right, we want to pay attention to that. If we know that this person used to be upbeat and lively, but now we have seen a switch in their mood to where now they're just feeling down and exhibiting a sense of hopelessness, that's important to know. Also, any type of loss of interest. So maybe it's a colleague, right, that used to love to hang out with other coworkers, or a family member that used to love to be around the family, but now they don't have no interest in doing any of that. They don't want to hang out with people. They just want to stay to themselves. That's important to note because again, that's a drastic change from how they used to be. And again, agitation and anger. If you see that an individual is just constantly agitated or just feeling irritable with people or situations, these are the type of things that we want to be mindful of. And the same thing with behaviors. We want to note certain behaviors, right, that change when it comes to individual. So are they giving away valued possessions? If you know that an individual had an object or something that was very meaningful to them, and now they're just giving it away, we want to pay attention to that because again, this means that this could be one of those warning indicators that this person is definitely thinking about engaging in suicide, right? We want to look at their appearance. Is this person exhibiting a neglectful appearance? If you know that this person used to be the type that was prideful in how they look and, always kept up their appearance, but now you're noticing the exact opposite, we want to pay attention to that. And any type of risk taking behavior, such as use of drugs or alcohol, are all warning indicators that, again, can let us know that, hey, this person may be thinking about trying to take their life. And now we are going to hear from the expert, Dr. Spirit, who talks about how she counsels her patients who may be dealing with suicidal ideation.
I work with individuals who have been suicidal in a moment. I've worked with individuals and do work with individuals now who have been suicidal for weeks or months. And then I work with individuals who are chronically suicidal, who have been suicidal for most of their lives. And what I have found is by not focusing on the suicidality, but focusing on getting to the root of the problem, that has been more effective in changing the idea about suicide. Because suicide is not the problem. Suicide is seen as the solution or the means to the end that will solve the problem. And so, what I really like to do is sit with them in a place of no judgment, with absolute empathy, recognizing that I ultimately do not have the choice in whether or not they attempt or decide to try and take their own life. So I let them know that for me, it's not about trying to change your mind, because ultimately the power of choice lies with you. But how can I get you to see your problems and explore all of the options that are on the table to you in resolving that problem? Because suicide doesn't resolve the problem. It only ensures that you don't get the opportunity to ever have that problem resolved. And so, what I have found is by not focusing on the suicide itself, but by managing those feelings while we are working on what is leading a person to be suicidal or even homicidal in some situations, Shanti, by focusing on the possible solutions, by linking them to the proper resources, whether that's medication management, whether that's treating the mental illness that they have been dealing with, whether that's healing the trauma, whether that's bringing in social workers that can help them with things that are happening in their environment, whether that's helping them to reestablish support systems of new loved ones, create new family and friends, change environments, whether that's relocating where they live or re-entering into other aspects of academia or other job, occupational experiences, but by really focusing what is on the root of what's driving the hopelessness, that can spark the change.
Again, so get into the underlying root of what may be causing these suicidal feelings is very important. Now we want to talk about suicide and stigma. We know that there's big stigma around mental health and that there's big stigma around suicide. And suicide stigma involves the negative attitudes, right, that others have about mental illness. And this is important because a lot of the times you may hear people use language such as, oh, well, that person is in a nut house, right? Or that person is loony. And using that type of language further stigmatize people that may be struggling with things or may be experiencing things. And it makes them not willing to open up or ask for help because of the stigma that's out there. Self stigma refers to the negative attitudes that individuals may have of themselves, right? Including internalized shame. So, a lot of the times, if something is going on with the individual, they may have this internalized self stigma, so where they feel that something is wrong with them. But I always tell people it's not what's wrong with you, right? It's what's going on with you because we know that life happens. We know that things happen in everyone's life that again it can just cause hurt and pain, but it doesn't mean something is wrong with us. And then it's that institutionalized stigma, which is more systemic, right? Because this involves organizations, right, that intentionally or unintentionally limit opportunities for people with mental health conditions. And this is very important for organizations to look at. I know for a lot of people, they say that they don't like to utilize the employee assistance program at their job because they don't want it to be documented that they reached out for help because they don't know if it's going to limit their opportunities to further advance in their career. So making sure that as organizations and institutions, we're creating an environment and implementing policies where it's not stigmatizing people that may be having mental health challenges is very important. We know that when it comes to suicide, prevention and early intervention is key. Counsel suicide stigma, right? How do we do that? Because again, we just talked about the stigma that surrounds suicide and that surrounds a lot of mental health conditions. And the ways that we can begin to counsel the stigma is what we're doing now, right? We're talking openly about it, talking openly about mental health conditions and suicide. That can begin to break the barriers down and normalize that people go through situations. Also, educating ourselves about mental health diagnosis, and again, some of the solutions that we can use to support other individuals that may be going through a temporary crisis. We know that language matters. Like we said earlier, using language that's sensitive and that's filled with empathy, right? Versus using language that's stigmatizing. So we don't want to say things like, oh, well, this person committed suicide, because we know that suicide is not a crime. But we want to use more sensitive language, such as this person died by suicide. And then supporting others. It's very empowering when we can support one another, when we can say, hey, I'm here with you and I'm right by your side. And that's hope. That's very empowering to do. So these are a lot of the ways that we can begin to counsel that stigma. So earlier, just as we talked about those risk factors and warning indicators, it's also important to talk about protective factors. We know that as human beings, right, we are very resilient. So it's certain things that we can do when we are facing a crisis that can help us and let us know that everything will be okay. And again, I'm not going to read everything, but I do want to point out some points from each section. So again, when it comes to psychological, right, having good coping skills when we're going through a crisis. And that's what we started out with earlier in the beginning when we did our mindfulness activity, right? Learning to just breathe and incorporate breathing exercises and incorporate meditation when we're going through things. All of these things can be a protective factor that can be a prevention against suicide. Also, having optimism and positive regard, knowing that things don't last forever, right? Knowing that it's going to be a light at the end of the tunnel. All of these are all protective factors, that resilience that helps us to keep going. In terms of social, right? Having those supportive family relationships, knowing that we have that village around us that will support us when we're going through hard times is very important, as well as participation in community. And that's very important because we want to connect to something that's bigger than ourselves. When we're able to do that, that gives us that purpose, that gives us that drive to keep going. And then by your physical, right? Making sure that we eat healthy, take care of ourselves, exercising on a regular basis. All of these can be a protective factor that can aid in the prevention of suicide, as well as spiritual, having that set of moral beliefs or being connected to a higher power. And again, knowing that this too shall pass are great protective factors that can help us aid against a crisis when we are going through things. Responding to warning signs, right? So this is important because if an individual is telling us that they're suicidal, it's a couple of things that we want to do. And the first things that we want to do is we want to ask the tough questions. And that involves asking the person, are you suicidal? And don't be afraid to ask this question because it's a myth out there, right? That if you ask someone if they're suicidal, then this may make them want to engage in the suicidal behavior more because we're putting that thought in their head. But that's not true. It's actually the exact opposite. When you're asking someone, are you suicidal? That actually lowers their defenses because now they're saying, okay, now someone cares enough to listen to me. And that makes them open up and to really be able to share what they're feeling. We also want to listen without judgment, right? So when we are supporting each other, when we are supporting our colleagues or our family members, we don't want to say things like, well, that is stupid that you're thinking like that. We don't want to do that. We just want to listen without judgment and let them know that we're here with them right in this moment. We also want to assess the severity of the crisis, and I'll go a little bit into detail about this in the following slide. But this involves asking them about, do they have a plan and do they have a method? And again, some additional steps that we can take, right, if they tell us yes. Again, we want to be supportive and offer hope, and we want to help them connect to resources. And this is also important because when we're helping a person connect to resources, we don't want to say, okay, here, call this number and just leave them, right? But we want to actually just be by their side and say, hey, I'm right here with you. How about we call this number together? And there are a lot of crisis numbers out there, and we're going to talk about that toward the end, such as 988 or the Georgia Crisis and Access Line, to where you will automatically be connected to a trained professional when you are going through a crisis. That crisis assessment, right, goes back to assessing the severity of the crisis. So if a person tells us that they're suicidal, we want to ask them, do you have a suicide plan? Okay. And if they tell us yes, we want to ask about the means. Do you have what you need to carry out your plan? So this is finding out if the individuals have any type of guns or weapons in the home that they can use. And if so, we may can even contact their loved ones or someone who the individual feel is a safe person for them, right? And ask them, hey, can you go over to the house and grab these weapons or grab this? Because right now, this individual is not in a safe place. We also want to ask about time. Do you know when you would do it, right? So we want to ask the individual, do you have a specific time or when you're thinking about doing this? And again, we want to ask about intention. Do you intend to take your own life? And if they are saying yes, again, we want to provide that support, stay with them, and automatically connect them to resources. And sometimes this can even mean driving the person to the hospital so that they can have an evaluation done. Managing life after a suicide attempt. This is very important to be aware of because for a lot of individuals who had planned to die by suicide, but it didn't result in suicide, they can be experiencing a whole lot of emotions, right? From guilt to shame to embarrassment. And this is the time to really rally around our loved ones, really rally around colleagues and friends, and let them know that we still support them and that everything is going to be okay. Managing suicidal thoughts. According to the Center for Disease Control, 12 million people engage in suicidal ideation on a daily basis. So that's a lot of people, right? And it's certain things that we can do to help us manage suicidal thoughts. One of the things that we can do is talk with someone every day, right? So this entails checking in on your colleague, checking in on your family member, asking them, are they okay? I would never forget the story of Kevin Hines, who is now a suicide advocate, but he tried to take his life by jumping off of the Golden Gate Bridge. And he said before he did it, he was on the bus riding with other individuals. And he said if only someone would have just looked at him and asked him, are you okay? Then he wouldn't have did it. But he said no one looked at him, no one asked anything, and that father validated his decision to jump off the bridge. So I say all this to say, to let you all know as gatekeepers, right? As family members and colleagues, you are so powerful just by checking in on someone and seeing how someone is doing. you're able to save a life. You can save a life just by doing something as small as that. We also want to challenge negative thinking, right? So I'm a firm believer that if we don't speak life into us, who will? So saying things like I'm worthy, I'm valuable, challenging that negative thinking. All of that is key to managing those suicidal thoughts. We also want to keep a written schedule. We know that when we have a routine, that helps keep us productive. And when we're productive, again, that can assist with managing suicidal thoughts, as well as making time for things that bring you joy, right? Doing things that you like, whether it's going out to get massages, whether it's going to a nice restaurant, remembering to do things that you love. And also remembering your personal goals. What is it that lights that fire in you, that gives you that passion? All of this is helpful when we're talking about managing suicidal thoughts. And now we're going to hear from the expert, Paige Gaines, who is a certified peer specialist, who talks about some of her own challenges with the mental health condition.
I've actually been living with mental health challenges since I was about 10 years old. So that is 20 years for just a lot of dark times. So at the beginning, it was just a lot of hopelessness, a lot of sadness. And then by the age of 11, I was going through a lot of isolation, which again is one of my biggest signs, even to this day. And then from that point, around the age of 12, I actually had my first suicide attempt. The biggest challenge for me dealing with that was that I didn't have the language to communicate what I'd been going through for all those years. I was a 10-year-old without the language of saying, hey, mom, I'm depressed, or hey, dad, I have anxiety right now, or hey, I don't want to live anymore. I had this huge secret of anxiety and depression in addition to now having tried to take my own life. So those early days were very dark and very hopeless. And it was just a challenging time for me. It was a challenging time to continue to go to school, to try to do well in my classes. It was challenging to go to prom and smile because, again, in our community, we always have to smile and everything always has to be okay. And it's often said, well, you don't really have anything to be worried about. You don't really have anything to be sad about. What could be wrong? When in reality, everything actually was wrong. So by the age of 21 and 22, my mental health diagnosis began to set in. I began having extreme symptoms. And then I was later diagnosed with bipolar disorder. But I like to point out the most important part about that experience was I was actually hospitalized. And prior to being hospitalized, I went to see my primary care physician because my parents just finally recognized I was at a breaking point and they had nowhere to turn. Again, we didn't have the language, we didn't have the resources. So I was sitting there having a conversation with my doctor, and she began to ask me this one important question, which was, are you suicidal? And there's a huge myth around this question as if it is going to implant that idea into somebody's head, when in reality, it was my first time of being seen. It was very validating for me. And my answer was yes. And I cried and I thanked her, and that was the start of my recovery journey. So just being able to maneuver that system, being able to learn the language, being able to get into therapy and get a psychiatrist, it definitely had its challenges, but the biggest benefit was, and the biggest helping factor was actually being able to, again, learn the language, because then I was able to communicate with my family. And I was able to communicate with my friends and say, this is what's going on with me. This is what's happening this day. And we were able to have a conversation, as uncomfortable as it was in the beginning. Excuse me, it turned out to be very beneficial, and it was strengthening to our relationship.
So again, we know that that language piece is important. And so when we're talking about managing life after a suicidal attempt, right, we know that there are certain first steps that the individual or person may want to take to get back into the course of things. And some of those first steps involves talking with others about reestablishing connection. So again, who are those people that we consider safe? Who are those people that we feel are in our corner, that if we ever are going through a crisis, that we can just talk to that person and say, hey, this is what I'm feeling. Also, making a plan to stay safe, right? So, we have all heard of safety planning. And again, after a suicidal attempt, making a plan to stay safe is very important. So, again, knowing who your contact people will be when you are in a crisis, knowing the crisis numbers that you can call and reach out to, all of this can be a part of that safety planning process. We also know that counseling, right? Getting into therapy is very important because, again, as we heard earlier, get into the underlying root of the underlying cause of what's causing that pain is very important. And we know having our crisis support is key. And when we're talking about going back to work after a suicidal attempt, we want to be able to discuss how to stay safe at work. Again, who are those colleagues that we feel we can talk to when we are in a crisis? We also want to be able to focus right on the things that we can control. So we don't want to worry about things that are outside of our control, but being able to stay positive and focusing on the things that we can control is also very vital. And then don't be afraid to ask for help. And again, this involves, even if it means talking to our supervisor, if we're having a lot of workload that is placed on us and it's becoming overwhelming, being able to tell our supervisor, hey, right now I'm feeling a little overwhelmed. So I'm wondering, what are some of the things that can kind of be taken off my plate so that I can be in this place of balance and positivity? And then developing a work plan, right? And this is about being aware of the workplace accommodations that we can make for ourselves. So, for instance, if we know that we do our best work at 9 o'clock, 8 a.m. in the morning, then prioritizing that, making sure that we do the most important work at 9 o'clock a.m. in the morning would be key. Suicide prevention in the workplace. We know that when we're talking about suicide prevention in the workplace, the role of employees and the role of employers are very important. When it comes to the role of employees, you all are the first line of defense, right? To being able to recognize if something is going on with other employees, to being able to recognize any changes in other people's behavior because we're around our other coworkers a lot. So again, we're going to be the first hand gatekeepers, right? And being able to recognize these changes in behaviors and being able to provide that support. And then the role of employers is definitely crucial, right? Because as employers, we want to be able to know, how do we let our employees know that they're not just a machine that produce profit, right? But we understand that they're human beings with lives. And we want to be able to focus on wellness and things that we can incorporate to make sure that we are supporting our employees. And when we're talking about that systemic change, right? How do we incorporate these policies into the workplace? Well, we know that begins with leadership. So that begins at the top, right? And being able to make sure that we're incorporating policies that are centered around communication. So whether we have safety huddles, whether we have staff meetings, being able to talk about mental health conditions, being able to talk about suicide prevention and meetings at the workplace, all of this is key because, again, it helps us to be able to focus on wellness and be able to break down that stigma when it comes to suicide. Also, looking at ways that we can incorporate assessments into the workplace, right? And these can be suicide prevention screenings or depression screenings, because being able to incorporate screenings into the workplace can help us as employers see which employees may need additional support and may need additional help, and looking at how we can support and help that person. And what we're doing now, having trainings, right? Having trainings on suicide, having training on mental health awareness. All of this is key when we're talking about implementation and making these changes in the workplace, as well as peer support, empowering one another and supporting one another. all of these is how we begin to make those changes in the workplace when it comes to suicide prevention. And I want everyone to get out your phone. Please feel free to snap a picture of all of these very important mental health number and resources. We have a lot of resources. And again, if you contact each of these numbers, you will be connected to a trained professional that can help you when you're going through a crisis. And the number that I really want to make sure y'all know is the National Suicide Prevention Lifeline number now, which is 988, right? 3 numbers that we can remember and dial. If we feel like we're in a crisis, if we feel like our colleague is in a crisis, again, we can call that number and be connected and get additional support. And all of these other resources are important as well to have. I want to thank you all for being here with me today. And I'm going to throw it back over to you, Miss Megan or Miss Nivea, to see if we have any questions.
Yes, thank you so much, Natasha. That was amazing. We learned a lot of information today, and we really appreciate you coming by and doing this training with us. There are no, yes, let's give Miss Natasha a round of applause. If you have your reactions, go ahead and shout her out. That was amazing.
Thank you. Thank you.
All right. I don't see any questions in the chat. I'll give another minute or two if anybody has any questions. I don't see anything. I see a lot of love though. A lot of love.
Thank you.
They said that was great. All right. Well, I'm going to close this out. Just a reminder that our chat or our webinar is available 30 days. Following this webinar, you will get an email from one of the Silence the Shame members, and with the link for the survey and a link for the webinar. So yeah, that's awesome. All right. Thank you all for joining, and we'll see you next time.
Bye, everyone.